Heavens to Betsy. Betsy McCaughey just took a hammer to Nancy Pelosi's healthcare toolkit and just, I think, banged it to pieces. Says it's 78 pages of talking points for the healthcare law, read like contrived cliff notes on the big bill, but with a lot of the same lines. Betsy, say it ain't so.
Well, it is full of weasel words and lies, but even more importantly, it lays out how the Democratic Party is taking a worthy goal, enrolling the uninsured, and corrupting it into enrolling voters.
That's the idea. These Democrats are nervous. They think they could lose the Senate on this.
This is an illegitimate attempt to end the two-party system. Let me explain why. The Obama health law says that in every state, community organizations have to be hired to enroll people in the health exchanges. Why is this job being outsourced from government employees to community activists? Because community activists can say and do things government employees can't say or do. Now, Nancy Pelosi in her toolkit tells her lawmakers in Congress to call Mark Weatherhorn. He has created, with Soros funding, a plan on how to train community activists to integrate voter registration into whatever their other duties are. In addition, Nancy Pelosi recommends that her lawmakers use Enroll America, an organization run by Obama staffers, campaign staffers. The president ran Obama's Iowa caucus campaign. They are going to be training these community activists to enroll.
But they have to still pitch the same lemon. So how are they, and what are they going to pitch?
They're pitching enrolling the Democratic Party.
But you've already cited a lot of the stuff that they're pitching that's just outright wrong.
Of course. Claiming that there's free preventive care, all these claims that we've heard for the last 2.5 years. But Americans should be very concerned to see this scheme to erode the two-party system by enrolling people in health insurance to enroll them in the Democratic Party.
But you're also saying that part of the stuff they talk about, enrollment and cheapening the cost of health care, that's a prominent theme in these 78 pages, the ones at least weren't wiped out.
Well, we know that's not true. We can look at the California exchange, which
which has cost you more, and premiums that have gone up.
50% increase in premiums, but even
don't you think members have called her and said, hey, Nancy, you're wrong on this. My constituents are paying much higher premiums. The young ones who you said are avoiding it are paying much higher than that.
Not only that, for the 50% higher premium, most people who enroll in the exchanges are going to have to give up the doctors and hospitals they currently like, because the pressure for premiums to go up under the Obama health law is so strong that insurers, to keep them from spiking even more than 50%, created restricted networks of doctors and hospitals, allowing you to use only the ones that will accept very low payments, below market payment rates.
The bottom line is you're reading these 78 pages, and when Nancy Pelosi says every health insurance plan in the marketplace will provide free coverage for preventive services, you say that it's actually not that case.
It's not free preventive care. You've paid for it up your front in your premium, which is higher than ever. There's no tooth fairy.
So, but isn't she also saying someone else is paying for it if you're not?
That's true, but even people who get subsidized health care on the exchange are going to find it, in many cases, unaffordable. A man who earns $29,000 a year, even after subsidies, is going to have to write a check every month for $137, and for that he gets a health plan with a $5,000 deductible. He may never get a dollar back on that.
Think this is, I know it's a trite expression, putting lipstick on a pig, and this thing oinks to hell, right?
Yes,
but
it also...
no way you spin on it.
It also stinks to hell, because when you see the corruption of our political system, that's even worse than the lies about health care.
Because this is all about roping in those who can be permanent voters, right?
That's right. And this template is repeated.
Did taxpayers pay for this 78-page toolkit?
They probably did, yes.
Amazing.
And worse, they're paying for the community activists, permanently funding those. Well, we have a president who's a community activist, and now he's integrated permanent taxpayer support for community organizations all across the country.
You are wicked smart. You realize that, right? Betsy McCaughey, she knows this health care law better than anyone I know. Scary stuff. And so that's why I immediately thought, hey, they had this Cliff Note version. What does she think of it? Well, as you can hear, not much. In the meantime,